Good evening, everyone. We're about to begin. Good evening once again. It's a lovely Sunday evening here in Bangalore. Our distinguished chief guest, dignitaries, guests, and my co-hosts. I'm Anita Niranjan, Managing Director of Global Healthcare Academy. On behalf of the entire team, I welcome all of you to the digital launch of our Global Dental Academy. I can't convey in words my deepest appreciation for the phenomenal response you all have given at short notice, as also for your dignified virtual presence here on a Sunday evening. Our founder, Dr. Ajay Kumar, has always believed in the industry and academy collaborative approach for better advancement in healthcare. He is a key proponent of a purpose-driven information exchange and knowledge share that becomes the voice of the entire scientific community across the globe. Global Healthcare Academy has been instituted with a mission to develop competent and compassionate human resources for the healthcare sector. GHA also promotes innovative solutions and enterprises in healthcare. Our core purpose is to bridge the skill and knowledge gap between formal education and needs of the healthcare industry. GHA has 6 verticals, the first one being the continued medical education program for our doctors and healthcare professionals, global healthcare journals, where we have launched 5 journals under our publishing wing, global lawyers for doctors initiative, where we kind of educate our doctors about their rights, skill development for young aspirants and upskilling for paramedic and nursing sector, promoting a few select university courses for their innovativeness and employability potential, and conferences. The distinguished features of GHA training includes intense collaboration at every stage between practitioners and tutors, from conception and formulation of training programs, enlisting of faculty with sufficient work experience, case-based learning from real-life situations, and practice-oriented learning methodologies. GHA is led, managed, and advised by reputed doctors and healthcare professionals. Today, we are here to launch a separate focused vertical for dental education, Global Dental Academy. Who better than Dr. Girish Rao and Dr. Anand Krishna to lead Global Dental Academy? They have trained more than 1,000 professionals in implantology alone already. GDA is founded on the premise that providing clinical and scientific knowledge to dentists via online and blended learning platform established with a vision to be an academic center for excellence, and to bestow access to clinical skill enhancement and promoting cutting-edge dentistry among dental students and practitioners. GDA wishes to make education globally accessible, effective, and efficient. I would urge all practitioners of the dental community to participate in the learning and increase the visibility of their pioneering work in this area. GDA programs will be vetted and approved by strong academic council members, advisors, and faculties, all renowned experts in their respective disciplines, and hence will pave the way for global recognition. Let us make this initiative a grand success. Let us all enable and empower this community to build a healthier world and a healthier tomorrow. I now call upon Dr. Girish Rao to deliver the welcome address. For people who very few of you wouldn't probably know Dr. Girish Rao, he is now the founder and executive director of our Dental Academy. Dr. Girish Rao is a professor and a senior consultant in oral and maxillofacial surgery with 30 plus years of experience in both academic and clinical practice. He is a consultant in several super specialty hospitals in Bengaluru, such as Sagar Hospital, HCG, Apollo, Shankara Cancer, Trustwell, and Nimhans. He was professor and head of maxillofacial surgery at RV Dental College for 17 years. He has published more than 25 papers in several international journals, has been a keynote speaker in several national and international conferences, and authored chapters in the international edition of the Hamilton Bailey's Clinical Methods in General Surgery and Leaford Access Osteotomy in Juvenile Angiofibroma. He was conferred the honorary fellowship by the Royal College of Surgeons of Edinburgh in 2019 and was also appointed as an examiner for the Royal College of Surgeons. Dr. Girish Rao, over to you to deliver the welcome address.
Thank you, Anita, for those wonderful words of introduction. Good evening, ladies and gentlemen, for my friends in India, Southeast Asia, Australia, and good morning to my friends in Europe and America. It gives me immense pleasure to deliver the welcome address today on this momentous day when we are launching this Global Dental Academy. If I recollect, in early 2000, Dr. Anand and myself started an exclusive implant practice in Bangalore. We placed and restored thousands of implants, and somewhere around 2005, we felt there was a need to basically start an academy, and that was the birth of our implant study group. We trained probably more than 1,000 dentists, not only from India, but from different parts of the world to embrace implantology. In 2010, we started the Advanced Implantology program, a program where dentists could actually plan and practice on freshly preserved human cadavers. This was the first cadaveric program in dentistry in India. Having done so much, we felt that there is a need to expand further. And during the pandemic time, we were contemplating how we could do a disruptive kind of technology which can really make a big difference, because education came to a standstill. And that's when online education really came into force. And most of the schools and colleges adopted online education. So we from Implant Study Group were also looking at how we can actually bring in online education into a platform. That's when our dynamic Dr. Ajay Kumar, he came into our practice one day for his dental checkup and said, "What are you guys doing in education space? Why don't you go global? Why don't you really take it to the next level?" You know, he's so infectious. I mean, being a marathon runner and a motivator to a lot of people, he just pushed us to this extent. And that's when the collaboration started between Implant Study Group and Global Health Academy. And that's the birth of our Global Dental Academy. Our vision and mission and core strength is essentially to bridge the gap between academics and clinical practice. And that's where we can actually make a difference in imparting clinical skills to empower dental practitioners to take their practice to the next level. We have a number of programs which we are excited to introduce. The implantology program is our signature program. We have 3 levels there. We have the foundation program, then the fellowship program, and the advanced implantology program. This is especially very important in scenarios like zygoma implants, which can be very well used in the COVID time when a lot of people have been affected with mucormycosis, the all-on-4s, the trefoils, the full arch rehabilitation, and maxillofacial prosthesis. In addition, we are introducing programs specifically tailor-made for emergencies in dental practice and dental practice in medically compromised patients. Infection control in dental practice. This is another area which we would like to really push people to take in and adapt safe practices in their own practices. Newer technologies which we are introducing, it could be from digital dentistry to smile designing, lasers in dentistry. We would also like to bring in 3D printed technology, especially in reconstruction of the maxillofacial region, and also introduce robotic surgery and navigation surgery in the future. All this is possible with collaborations between world leaders who will come into this platform and share their skills with us. Today, for this launch, we have a very distinguished chief guest. We have Dr. C.N. Ashwat Narayan. He is the Honorable Minister for Higher Education, IT and BT, Science and Technology, and Skill Enhancement Programs of the Government of Karnataka. He is a dynamic leader who has put technology into the forefront and taken our state, the state of Karnataka, into the forefront in our country. Sir, we welcome you for this program. 2 very distinguished clinicians who are also with us today as guests of honor. we have our good friend, Dr. Jekar Shetty. He is currently the Vice Chancellor of the Rajiv Gandhi University of Health Sciences and also a distinguished prosthodontist. He is with us, Dr. Jekar Shetty. We welcome you for this program. We also have another icon in the field of dentistry, Dr. Mahesh Verma. Dr. Mahesh Verma is the Vice Chancellor of the Guru Gobind Singh Indraprastha University. He is a world leader in prosthodontics. He has been awarded the Padma Shri, and also he has got the BC Roy Award. Dr. Mahesh Verma, we would like to welcome you for this program. Thank you very much for being there with us.
Thank you, Girish.
Two other leaders, global leaders in the field of dentistry are there today to address us as keynote speakers. My very good friend, Mr. Austen Smith, a senior consultant at Sheffield in UK, and he is also the president of the British Association of Oral and Maxillofacial Surgeons. He is going to deliver on the kind of training which is there in UK and will share his vast experience with us. We also have Dr. K.S. Nagesh, my teacher and mentor, probably one of the most senior dental practitioner in this country, a very eminent oral medicine professor. He was the former principal of RV Dental College and also former director of public health education in Rajiv Gandhi University of Health Sciences. He will also be delivering today a keynote lecture on the current dental scenario in India and how changes can be incorporated which would enhance our clinical practice. In addition to that, we have our very distinguished academic council members. We have a number of them who are the leaders in our fields, who are very, very important for this Global Dental Academy. They are going to vet our programs and improve our quality care in our practice. A team consisting of Dr. K.S. Nagesh for oral medicine, Dr. Muhammad Fayazuddin. He was also my teacher at Government Dental College, professor and head of periodontology, and also emeritus professor at Rajiv Gandhi University of Health Sciences. Dr. C.S. Ramchandra, who was the former principal of Marathi Dental College, one of the most distinguished orthodontists in the country. Dr. Rupa Nadig, another iconic endodontist, former professor and head of endodontics at Dayanand Sagar Dental College, and also she was the director of postgraduate education over there. My good friend, Dr. David Taro, he is professor of maxillofacial surgery at Bapuji Dental College, former, and also was the past president of the Association of Oral and Maxillofacial Surgeons of India. Professor T.V. Padmanabhan was the chairman of the Indian Board of Prosthodontics, again a leading light in the field of prosthodontics. Dr. Praveen, he is the professor and head of pediatric dentistry at RV Dental College, and Dr. L. Nagesh, who is the professor and head of public health dentistry at Dayanand Sagar Dental College. All these distinguished academic council members are the guiding light for our Global Dental Academy, and they will be looking at us, they will be looking at quality control and also advising us as to how we can improve the quality of programs which we would like to empower our practitioners to basically embrace on and take their dentistry to the next level. We also have a number of international and national advisors and faculty who are all there with us in this Global Dental Academy. We have Dr. Lakshman Prasad from Rhode Island, USA, an aesthetic dentist, a brilliant clinician. I've spent quite some time lecturing along with him, and we have learned so much from him. Dr. Rodrigo Marino from Belo Horizonte, Brazil. He is also a senior consultant maxillofacial surgeon. Dr. Ajit Brito, an orthodontist from Washington, D.C. Dr. Girish Bharadwaj, again, a consultant oral surgeon from UK. Dr. N. Sridhar, senior consultant periodontist from UK. Dr. Joe Butt, one of the most distinguished and very successful implantology practitioner in UK. Then we have Dr. Narayan Butt, dental practitioner and orthodontist in Georgia in US. Dr. Shilpi Ajwain from Australia, Dr. Ashok Ramadarai, who is a consultant maxillofacial surgeon in Chennai, Dr. Rohit Shetty, consultant prosthodontist, then Dr. Thomas Zakaria, again a consultant maxillofacial surgeon from Chennai, Dr. Emily Strong, consultant maxillofacial surgeon from UK, Dr. Raven Joshi, Dr. Vinay Singh Yadav, Dr. Gauri are some of these faculty who will all be imparting their knowledge and sharing a lot of platforms on educating a number of practitioners. I believe that collaborations between practitioners can actually help in imparting better knowledge, and I sincerely hope a lot of dental practitioners will use this platform and take the dentistry level to the next level. Thank you so much. I would also like to end up by thanking Dr. Ajay Kumar, who is the executive chairman of Healthcare Global, an icon in the field of oncology, who has transformed the kind of oncology setup in India, setting up multiple centers across the country and taking oncology in par with anywhere in the world. And I'm sure under his guidance, this Global Dental Academy and Global Health Academy will reach greater heights and will reach out to the world. And I think India has come to an age where, from the time we were going and learning, to learn skills from different countries such as Europe and America, today there are a lot of practitioners who are seeking out for India, not only to learn, but also come in here and get hands-on training experience. That's our vision. And with that, I would welcome each and every participant who's joining us today on a wonderful Sunday evening for this launch. Thank you so much.
Thank you, Doctor. Thank you for that lovely welcome address. I now invite Dr. Ajay Kumar to tell us his vision for GHA and beyond. Dr. Ajay Kumar, as Dr. Girish already mentioned, is the executive chairman of Healthcare Global Enterprise, very well known as HCG, and also the chairman of Global Healthcare Academy. Dr. Ajay Kumar's contribution to the field of cancer care in India, as well as his successes as a first-generation physician entrepreneur, has been widely recognized. He has been awarded the Ernst & Young Entrepreneur of the Year Award, the CII Regional Emerging Entrepreneurship Entrepreneurs Award, and the BC Roy Award by the Indian Science Monitor. He is also recipient of the Karnataka Rajyotsava Award. Dr. Ajay, over to you.
Thank you very much, Anita, and welcome everyone. And I know today is a momentous day from what we heard from Anita and Dr. Girish Rao. First of all, I want to congratulate Dr. Girish Rao and Anand Krishna for taking up this venture of GDA. And I do feel today what India lacks is academic and research program. We are excellent physicians, and I myself, having practiced in US in the past for 28 years and coming back to India, I know the caliber of the Indian doctors and Indian capabilities are immense. As I always say, when we can run major organizations all over the world, like, for example, Google, Microsoft, MasterCard, IBM, and also be prominent doctors across the world, why is it we don't have the ecosystem in India to become shine? And I think the platforms like this GDA under GHA is the ideal place to really explore this, where our doctors' talent are shared, where we can be innovative, where technology can be fused with our medical knowledge. And today, I think that is where we can progress, we can leapfrog. So in this regard, I really want to wish all the best for the GDA launch. I am sure under the leadership of Dr. Girish Rao and Anand, with Anita being there, it will propel us to a different high level where we'll become leaders in this particular field. And it is very much needed today. We know how dental care has progressed across the world, and doctors like Dr. Girish Rao and Anand have done their huge contribution to that. And with the eminent panel there are today, I am sure that we will have exchange of ideas, and this will set the platform for future growth. I always believe we talk, but we have to walk the talk. Hopefully, with that, we can achieve our goals of spreading this information, conducting workshops, and training program, not only for India, but entire emerging market and beyond that. So in this regard, today's momentous launch, I wish everyone, all the participants, all the success, and wish you all the best. Thank you for having me. Thanks a lot.
Thank you so much, Doctor. Thank you for being with us. I know it's very early for you right there in Dallas. Thank you once again.
Thank you very much, Anita. Thanks. All the best.
Thank you, Doctor. Our chief guest for this evening is Dr. C.N. Ashwat Narayan, Honorable Minister for Higher Education, IT and BT, Science and Technology and Skill Development, Government of Karnataka, India. Dr. C.N. Ashwat Narayan is our Honorable Minister for Higher Education. He has been leading us in the front, especially when it comes to entrepreneurship, healthcare, and skills, which is one of the area which we have to focus on. A multifaceted personality and a firm believer of technology, Dr. Ashwat Narayan C.N. is an educationist, healthcare entrepreneur, and a philanthropist. Unfortunately, he is touring the districts at the moment, and he is unable to join us. So he has actually asked Vishal Rao to convey his message. So now I invite Dr. Vishal Rao to kindly let us know what the minister had for us. For people who don't know Dr. Vishal Rao, he is the head and neck surgical oncology and robotic surgeon at HCG. And he is the regional director of for head and neck surgical oncology and robotic surgery, and also the associate dean of the Center of Academic Research at Healthcare Global. Dr. Vishal Rao, over to you with your thoughts.
Thank you. Thank you, Anita. Very good evening to all the participants, and good morning to the other parts of the people participating from other parts of the world. At the outset, I would like to take this opportunity to congratulate Dr. Girish Rao and the entire team of GHA who have taken all these Herculean efforts to bring this day and these efforts into fruition. Dr. Ashwat Narayan was unable to make it for the program because of a sudden district travel, but has conveyed his best regards to all of us. Actually, through this entire pandemic, when he was recently the Deputy Chief Minister till now, he has been one strong pillar of support who has been constantly encouraging us to spearhead activities that bridge technology with education. And since he plays both portfolios, he has always been, as a doctor, it's a very rare combination for us to get somebody who balances both of these departments very well. And we saw him through this entire pandemic encouraging us to setting up the first genomic surveillance committee for Karnataka, which led us to spearhead some of the best experts in the field of genomic studies to come together with academicians, Indian Institute of Science, NCBS, NIMHANS, Strand, and all of us coming together to put together a very state-of-the-art genomics panel for Karnataka. And today, it was also when we shared with him this vision that he was most excited to support this endeavor, to say that not only going beyond education and technology, this could actually also serve a great purpose in skill development. So he has wished his best to all the participants and conveyed his special regards to Dr. Girish Rao, to Dr. B.S. Ajay Kumar and the entire team, and wishes his best. He'll be sending in his a special message also shortly to be used by the Global Health Academy and the GDA for their academic purposes. I think with that, I would like to also add that a few years back, when Dr. Ajay Kumar actually envisioned the Global Health Academy, the idea was that time to actually encourage and support the ecosystem of research and innovations in healthcare. He often would speak to us about the aspect of how academia and industry are a disconnected group in the country, and how there was need, like how global efforts in United States, United Kingdom, Europe, and several other countries are going on, that there would need to be a meaningful bridge between academia, research, and between the industry. So GHA was born out of one such vision, that was envisioned to bring these three areas together: the research aspects, the innovation, and the academia aspects, and bridging them with the industry. So under the four headings of academics, research, training, and the clinical aspects, GHA was envisioned to create a platform. And rightfully at that time, the COVID pandemic had hit us, and we thought this is the time to re-innovate, and an online platform was set in. I am personally been a participant, a faculty, and course director to some of these programs, and I was feeling feeling very touched about the fact that we could achieve so much. I was having my own doubts when I used to speak to Anita about whether we will be able to get some of these online programs of with meaningful teaching. Coming from the conventional way of learning, we never thought we would see this day. But I was surprised to see when we launched the robotic surgery program, the laser surgery program, the amount of international participations we got, and the value addition we were able to create. So it was for me a myth buster to my own conventional impediment of thinking that we can't do such effective learning. We then moved on to hands-on training, the simulations. So, and I think Anita will soon be introducing the complete virtual reality learning soon with the GHA virtual classroom. So I think coming days we will see a lot more amount of innovations in education, and GHA is committed to driving this. I congratulate Anita and the entire team for all their genuine efforts in shaping these programs, and wish the entire program all the best from our entire team side. Again, a special thanks to Dr. Girish Rao, and he has always been an inspiring beacon of light for all of us. We look forward to him as the ever energetic person who constantly is the trailblazer for a lot programs which we think conventionally wouldn't be possible. So when Anita came and told us Girish Rao sir is now going to spearhead this entire thing, for us it was nothing more than welcoming, and today we are seeing this witness here. So thank you very much, sir, for all the support and encouragement that you have given to this vision. I wish all of you all the best. Thank you very much.
Thanks, Vishal. Thank you so much.
Thank you, Doctor. Thank you so much. We look forward to receiving the message from our Honorable Minister. Moving on, our next speaker, keynote speaker, is Dr. Austen Smith, who is the President of the British Association of Oral and Maxillofacial Surgeons, United Kingdom. Dr. Smith is a senior OMFS consultant in the South Yorkshire Regional Unit with interests in head and neck surgery, reconstructive, laser techniques, and head and neck intracranial vascular lesion. He has extensive experience in advanced collaborative neurovascular techniques, technically advanced 3D generated reconstructive concepts, and management of difficult iatrogenic diagnosis such as osteoradionesrosis and medication related to jaw necrosis. He is an elected member of the Specialty Advisory Committee running UK OMFS specialist training. Currently, he is the president of the British Association of Oral and Maxillofacial Surgeons, UK. Dr. Austen, over to you.
Hello, my name is Austen Smith. I'm a maxillofacial surgeon in the United Kingdom, and the first thing I'd like to do is send my greetings to my friend and colleague Dr. Girish Rao, his family, to his colleagues in this initiative and the team workers that have put together what is the Global Dental Academy. As I said, I am an oral and maxillofacial surgeon based in the United Kingdom. My centre of operations is in Sheffield in Yorkshire, and I am currently the president of the British Association of Oral and Maxillofacial Surgeons. I've been asked to give an overall picture of the UK situation in terms of dental education, and you should remember that in the United Kingdom, oral and maxillofacial surgery is a doubly qualified profession or specialty within the medical remit. So we are dentists, but we are also qualified doctors with a surgical training. I send my greetings to you all. I was asked to comment and to speak on the topic, the challenging scenario of dental education in the United Kingdom and other parts of the world. And I will try to do justice to that as far as I view it from my perspective here in this country. I'm unable to comment in detail on other parts of the world, but I have travelled widely, including to the subcontinent. And I expect and hope that other people will put me right if I get things wrong. The thing I don't want to do is to harp too long or in too much detail about the effects of the pandemic of the coronavirus, because it's not really relevant for the future of dental education and bringing new professionals into the area to provide clinical care. We all know it has brought chaos to all educational levels, with universities suffering, but hopefully once it's passed, we will get back to normal service and be able to resume fruitful education at the centres of recognised education in dentistry and other specialties. The postgraduate and real life, or what you might call high street everyday dental provision of care, took a big hit in the United Kingdom. It's been affecting dental practices which have effectively been closed for a period close to 15 months and getting back now 18 months with no real return to normal working as we knew it before. There are many restrictions on practice. There are protocol and procedural driven extra steps that need to be done for even the simplest care, which makes the speedy throughput and a productive and fruitful dental practice quite difficult to maintain. So what do I regard as the main issues or challenges in dental education in the United Kingdom? Well, remember, these are my personal opinions and they may not gel with the official stance of the competent authorities and regulatory bodies within the United Kingdom. But I see currently in my everyday encounters with professionals and the patients that come between them and me on a referral pathway, probably 6 main areas that I would have concern about. The first one is the scope of the individual practitioner, and I'll cover that in a few minutes. The second one is the consistency of the educational material that the undergraduate dental students and to a degree postgraduate dentists are exposed to. Following on from that is the quality, and then obviously the sanction or the badging or the authoritative approval of what's being produced. Finally, the lack of governance that's been brought about by technological advances. And the last thing is that fine balance between what we all understand as the business ethic, because at the end of the day, a practitioner is in business and is furnishing funds for their family and generating an income, and those professional values and the professionalism that we hope would never be forgotten and that needs to be inculcated in students right at the beginning so that they have a direct, correct line to work through life without putting a foot wrong and getting into trouble. So if I go back to scope, my view is that within dentistry in the UK at least, there has been a degree of over-specialisation. We have the restorative dentistry mono-specialties that deal with periodontology and prosthetics and endodontics and the subtle nuances of those areas. But it does seem from a small town perspective in a medium-sized hospital that the impression of the referral pattern is that many general dental practitioners are very hampered in what they are able to achieve. And that's partly because they have not been subjected to the specialist training and therefore registrability for the mono specialties. And unless there is a practitioner within that given practice who has a given interest in either surgery or endo or similar areas that are specialist, there's a common pattern emerging of referring on elsewhere. In summary, it means that the actual general dental practitioner that we used to know is perhaps not as widely capable. That may be a good thing or it may be a bad thing, because if the people who take on the specialist area are well trained, we would hope that that provision of care would have improved quality. The second concern I have is the consistency. If we go back to when I was a dental student, we would be told one book for each subject, which we would all read and we would all know and we would be examined on. There will be wider reading, but it might be 3 or 4 books per topic and per area of clinical practice. Now there are literally thousands of publications, some of better quality than others, and I'll cover that in a minute. The one thing that has come is that there is a wider assumption and adoption of good clinical practice, scientifically defensible material, and with an audience of millions. If you put something up there on the internet or in a published form that is not correct, you can be certain somebody will spot it and the word will go out that the quality is poor. However, the level of consumption outside of the practitioner, in other words the public, can and are easily misled by spurious evidence, by fake news, by rumour and gossip stories about clinical issues, including dentistry, which can be very counterproductive and actually harmful to the common good. When we get to quality of the material used for teaching and training the dental student or professional, clearly now it's not possible to publish without good quality peer review material, and that therefore does give a body of evidence that it should be possible to get knowledge about any particular field in dentistry. It's easy to look things up. There is wide free material with free reference, either through corporate bodies, institutions, clubs, associations, to get solid peer-reviewed, sometimes internationally renowned peer-reviewed material of high quality. The fourth thing I wanted to cover was the sanction or badging. And I often tell patients, if, as you probably will, when I tell you about something, you will run along and look it up on the internet. If you are looking at some material that's furnished by the University of, or the National Institute of, the high likelihood is that it... One of the slightly surprising changes within the United Kingdom has been the effect of preventive strategy over the years. And this has exhibited itself in some dental schools with a lack of patients requiring exodontia, and in particular in some parts of the country with children's dentistry procedures being short or even absent because of the success of fluoridation and other strategies in reducing the level of tooth decay and therefore the demand for those services. I happen to work in an area that unfortunately still has quite prodigious and wide-reaching dental neglect and disadvantage. And so in my team, we regularly spend Thursdays with a general anaesthetic list taking out large numbers of teeth in children who seem to have no family perception of sugar, the usual risk factors for poor dental health. And that's slightly worrying that in a supposedly first-ranked country like the United Kingdom, there can still be such widespread levels of disease. That brings us on to training volume and the breadth or rarity of things that are available. In some areas, as I've said, there may be some parts of dental care that are difficult to teach because they just aren't the patients. So then we have to rely on other methods. And we all know about the teaching by remote or by virtual methods. In the United Kingdom, in surgery, which I can speak about because it's an area I'm involved in, there is at least one thing that I feel is a prime example of good practice, and that is a structured, universal and nationally applied training system for all surgeons of all specialties at the postgraduate stage, taking them up to specialism. And that has been a revelation in terms of standardizing the teaching, the requirements, the quotas, what we call workplace-based assessments. And these are a universal currency that everybody can understand. So in conclusion, I would like to state what I feel is needed in a system for dental education. And again, these are my views. Firstly, there's an absolute requirement for quality educational material. It's no longer acceptable to keep trotting out the slides that were generated 20 years and just go through the lecture again. It has to be updated. It has to be peer-reviewed evidence. The regular updating can even be on a monthly basis because things change rapidly, and particularly in the furnace of research that's been around COVID and its attached issues. There's been massive steps made in research, and the same, I feel, should be important in dental world. The material should be monitored for quality by either a separate group or by somebody who has no particular vested interest in what is being produced. And the format should be easily digested and presented with a clarity that allows the student to absorb it, allowing for the various rates at which people learn. Some people can take several goes to learn something, but once they have it, it's there for good. Others can grasp it quickly, but a few months later have forgotten. And that needs to be built into any educational system. Finally, it needs to be stepwise and above all logical, so that it can be see, do, teach. It is possible to grasp the essence of it, to understand why it is done in such a way, to be able to reproduce that, and hopefully then to pass it on. And these are the features that I look for when I see the exploits in future of the Global Dental Academy. And I hope that I've been able to give you a little insight into my view of what's going on in the United Kingdom and other areas. I would again like to say best wishes to the team for this initiative. I would like personally to say hello to everybody who is watching or who signs in. And from Sheffield in the United Kingdom, bye to you all.
Thank you so very much, Doctor, and thank you for being with us today. And it really means a lot for us. And I'm sure we'll continue to look up to you for guidance as we progress in this academy. Thank you so much. Moving on, we have our next keynote speaker, Dr. K.S. Nagesh, who is the former principal of RV Dental College, former director of public health at the Rajiv Gandhi University for Healthcare Sciences. Dr. K.S. Nagesh has outstanding experience of 50 plus years in the field of dentistry. He was the professor and HOD of oral medicine, diagnosis and radiology, and the founder principal of RV Dental College for 20 years. He was also the director of public health at RGUHS. He had published several papers, authored several chapters and textbooks in the field of oral medicine, diagnosis and radiology. Recently, Dr. Nagesh has been conferred with the prestigious award, Doctor of Science, honoris by the Rajiv Gandhi and Health Sciences Karnataka at their annual convocation in 2019 for exceptional contribution in the field of medical education and public health and research. Dr. Nagesh has also been conferred the highest civilian award of Karnataka, the Karnataka Rajyotsava Award. He was also the chairman of Ethics Committee for Human Subjects in National Institute of Mental Health and Neurosciences. Dr. Nagesh also held other coveted positions like the president of ACO MFR and regional director ICD MFR. Dr. Nagesh, over to you.
Dr. Jaikar, Vice Chancellor, Rajiv Gandhi University of Health Sciences, Dr. Mahesh Verma, the guest of honor, Dr. Ajay Kumar, Chairman HCG, Dr. Girish Rao, Dr. Anand Krishna, and Dr. Joshi. First of all, I would like to thank inviting me to speak on the dental education, how it has progressed from the beginning. In the first dental college in the country was established by Dr. R.A. Ahmad in the year 1920 at Calcutta. He was a visionary. He took the journey to England by ship. Those days only ship journey was there. Learned the dentistry, came back to Bengal and started the first dental college in Calcutta, which has been named as R.A. Ahmad Dental College as a mark of tribute to him in the centenary birth celebration of his last year. That is, it was established in 1920. So 2020, they named it as R.A. Ahmad Dental College. And subsequently, at the time of independence in 1947, there were 3 colleges in the undivided India. And later on, the government of India, as well as state governments, thought we have to give an impetus to the dental education. That's how the dental colleges were started by the government in most of the states. The first self-financing college was established by Manipal Group in the year 1966. And Bangalore Dental College, Government Dental College, was established in 1958 by late Dr. S. Ramchandra, who himself was a visionary to spread dental awareness. But the real impetus for the dentistry was in the year 1992 onwards, when number of private dental colleges were established in Karnataka, Maharashtra, Tamil Nadu, and subsequently in other states of the country. As on today, we have 315 dental colleges in the country teaching BDS, and MDS, 269 colleges are there to teach different specialities of dentistry. And total turnout of graduates in the country, as far as per the registration of the various state dental councils, it is about 2,73,856. And as on today, there is about 26,949 VDS seats, and approximately the MDS seats is about 6,000 in the various branches. But all the dental colleges were brought under Rajiv Gandhi University of Health Sciences in the year 1996 in the state of Karnataka. This enabled all the colleges to teach uniformly, both at BDS and MDS level, and also the assessment of students were also on the same line, as all the colleges came under the umbrella of Rajiv Gandhi University of Health Sciences. So all the state governments established most of the private colleges under the banner of independent universities, health science universities, bringing all health science colleges, medical, dental, Ayurveda, nursing, under one umbrella to have the uniformity in training and syllabus. As I said earlier, the Rajiv Gandhi University of Health Sciences was a leading university, prepared the curriculum for BDS and MDS. We are fortunate to have Dr. D.K. Srinivas, who was the director and dean of Jipmar Institute, Pondicherry, who joined as consultant at Rajiv Gandhi University, and he guided all of us to have uniform training in both BDS and MDS which has been followed by Dental Council of India. In spite of this, the dental practice, if we come to this, is what I have now narrated is about the dental education. Now, the dental practice, how it has progressed, if you have a look at the picture, I graduated in 1969 and 1970, joined the government service. At that time, there were only some 2-3 private practitioners in Bangalore city, and maybe in other cities, there were not any practitioners. But the job of a dentist those days was limited only to removal of tooth, oral prophylaxis, then restoration of teeth with amalgam and silicate cements, and also limited orthodontic practice. But the training of BDS graduates enabled us to carry out what is the primary requirement both in urban and rural areas. But when the private colleges were established in the year 1992 onwards in a phased manner, both in Karnataka and other states, that really got the impetus for the looking at training in different aspects because of 3 reasons. One is number of colleges had started MDS program in all the specialties. So all the specialties MDS students were trained to have in-depth knowledge and training, because basically dentistry is the skill-oriented one. And we saw liberalization of imports, and as a result of Government of India's policy of liberalization, which enabled us to import whatever the material and equipment needed for the dental practice. Simultaneously, some of the local dentists became entrepreneurs, and they also started manufacturing dental equipment. So all these things enabled the dental practice to enlarge. And since the economic conditions of the general public also improved with this liberalization, they were able to afford whatever the specialty dental treatments that were in force. Because earlier, the dentistry was in the lower cadre of priority for a common man because of the economic situation. So more medical problems getting the attention. And when once this liberal they were able to spend money on the dental practice also. Then the dental practice being, as I said earlier, a skill-oriented job needs to be training at the college level. But when once a student pass out, this they go into practice or government service, they need to periodically get upgraded with the skill and the newer dental procedures that are in vogue. We are teaching today's teacher. We are teaching dentistry of yesterday to students of tomorrow. So we need to look at the constant training programs, short-term programs for the teachers, because the universities and other bodies, they revamp the curriculum as once in 10 years or once in 5 years. And since we are teaching the syllabus of yesterday to the students of tomorrow, we need to always upgrade our skills. In this connection, there should be a lot of short-term training programs. For example, in the field of implantology, in the field of CBCT, or in the field of aesthetic dentistry, as well as other branches. We should have very short-term programs like weekend programs. All modules we can send by mail, and hands-on courses to be done at different centers. So this will enable the dentistry to grow further apart from just removal of tooth restorations, because newer restorative materials are coming into the field. Newer areas of training have to be formulated and also target both the fresh students as well as the practitioners, because after practicing for 5 or 10 years, one has to upgrade his skill, be conversant with the newer materials and the technologies. So this is possible only if we have flexible training programs, that is hybrid programs, the student or the practitioner receiving the theory materials and in a module, and come for the contact programs or the hands-on programs at different centers. We have to see that these centers are fully managed by highly specialized ones in the training of the students, and training of the faculty also is required to upgrade the dentistry. Now, oral and maxillofacial surgeons have made a rapid progress in treating different aspects of skeletal, oral and facial skeletal system. Prosthodontics also have joined together to help in the restoration of the facial structures. For example, recently we find that there is a lot of black fungus which affects the maxilla, and oral surgeons and prosthodontists as well as oral radiologists they need to work closely. But this process of continuous training is very much required, because once we learn something in the college or in the practice, because we learn many things from patients also, since patients are now very technique savvy, they will find out what are the treatments available. So we must be able to tell them that we are competent to do the treatment. So we need to have a continuous update. So we have to learn something, but tomorrow it may become an obsolete. So we have to unlearn it, whatever we have learned, and again relearn, so that we will be in pace with whatever that is happening, not only in India as well as the outside. In this connection, I would like to give a suggestion that this academy can have a tie-up with the different foreign universities or bodies, notably Karnataka State Medical and Dental Alumni Association, with whom I was associated. There are nearly about 6,000 doctors from Karnataka alone in America, both medical and dental, and they undergo a lot of weekend training programs. So we can look up a tie-up with KSMDA for the training of our faculty and the practitioners in the coming years. I'm sure this forum will bring in the best of technology from both East and West for the benefit of mankind, because we have to look beyond our borders and bridge whatever the gaps. Let us build the bridges and not the walls, so that we will be able to offer a wide variety of treatment to the people who are certainly in need of it. I'm sure that under the leadership of Dr. Girish Rao and Dr. Anand Krishna and others who are all associated, I don't know the other, many people are associated with this. So this forum is going to bring the best of the things globally to enable our graduates, BDS graduates, MDS graduates, practitioners, faculties to equip themselves for the better treatment, better training, and also offer the best of the training to the general public who are in need of it. And as we know, that I would like to quote from a Upanishad, let noble thoughts come to us from every. So let us be open in our mind to get the best of the things from any part of the globe and inculcate in our curriculum and syllabus, and also develop various short-term weekend programs for the benefit of practitioners and others who are in the field of the dentistry. Once again, I would like to thank the HCG chairman, Dr. Ajay Kumar, Dr. Girish Rao, and Dr. Anand Krishna for inviting me to speak, and also would like to thank Dr. Joshi for assisting me in this talk. Thank you very much. Jai Hind.
Thank you so very much, Doctor. Looks like Dr. Girish Rao and Anand Krishna had already, heard you on all this. There was a telepathy already happening. So a lot of things are under consideration already, especially the thought that you brought about regarding working with international universities and with our alumni of, dentists out here. So there's progress in that area. It was a lovely talk. Thank you so much. And we continue to look forward for your guidance and assistance as we progress in our academy. Thank you so much, Doctor. Moving forward, we have Dr. Anand Krishna with us, who is our founding director. Dr. Anand Krishna is a renowned prosthodontist and an implantologist with extensive clinical and teaching experience in implantology and complex restorative protocols. He graduated from the Government Dental College here in Bengaluru and completed his MDS in prosthodontics from the A.B. Shetty Memorial Institute of Dental Sciences. Dr. Anand Krishna is the first board-certified prosthodontist from the Indian Board of Prosthodontics and a diplomat of ICOI. He has been in academic teaching and has served in various institutions. His final tenure was a professor at the M.S. Ramaiah Dental College. He is also occupied various designations at several national and international organizations. Some of them include the Secretary of the Indian Board of Prosthodontics, Secretary of the Indian Prosthodontic Society, Bengaluru, Ambassador ICOI, and Vice President of the Indian Prosthodontic Society, Coordinator ICOI for South Asia, and an Executive Council member of IPS. Dr. Krishna, over to you.
Yes, thank you, Sanita. Shri Guru Bhyo Namaha. Good evening to one and all. I'll just take you through the vision, mission, and what Global Dental Academy is made of. Global Dental Academy is founded to create blended learning ecosystem to enable dental clinicians and students to upgrade their skills with world-class resource people mentoring them. Our mission is founded on the premise that providing clinical and scientific knowledge to dentists via online and blended learning will make education globally accessible, effective, and efficient. Through the COVID times, we have known that the access to education itself is such a big challenge. And also the traditional forms of learning has its own limitations, and it is not very efficient in the sense you will have to travel, you will have to do many things to get the traditional form of learning in continuing education at least. This is constituted to bridge a discernible gap between formal education and clinical practice in dentistry. This idea came about when Dr. Ajay Kumar, who is an inspiration to us and to many medical entrepreneurs in the field of medicine and education, proposed to us to join hands with Global Healthcare Academy. I was remembering my own initial days when we had to train in a particular aspect. We would travel all the way to Germany or USA for a program which would cost us a fortune. But today, thanks to the COVID, there has been a paradigm shift in the way we conduct our meetings, we conduct our continuing education. We have kind of accepted the online learning form as one of the modalities. GDA plans to utilize this and to give access to clinicians with world-class skill enhancement programs. This will include self-directed learning, module-based didactics, practicals, and clinical modules under the supervision of experienced teachers. Many of these programs will also have international university affiliations, like how Professor Nagesh sir just mentioned. The programs will be divided into short-term, medium-term, and long-term programs, and it will be specific to a level of expertise as initial, medium, or advanced. So a participant can come in at any level and go out at any level. So there is flexibility in learning, which is one of the main advantages of such academic platforms. Right now, we have homed on the following programs to begin with. First of all, the oral implantology program, which we bring in from the implant study group itself. We have divided this program into foundation, fellowship, and advanced programs. The foundation program is for undergraduates and fresh graduates, just to get an insight into what implantology is. Fellowship program is for a beginner who is serious in practicing implant dentistry. This will have an online and an offline component where the participant will place implants on simulated jaws and on patients. Of course, it will also have didactic lectures. It will have module-based learning. They'll have also contact sessions. The advanced programs for clinicians with some experience on implantology and they want to upgrade their skills in a particular aspect. All on 4, the trefoil concept, hard tissue and soft tissue grafting. These are the programs which are being earmarked in the advanced implantology program. The second program is infection control in dentistry. With a growing number of communicable diseases and with our recent experience with the COVID situation, we have learned that infection control is most critical aspect, first of all, to keep ourselves safe and then to our patients also being safe. Medical emergencies and in a dental practice and management of medically compromised patients. This is the next course. Medical emergencies can be life-threatening situations that can occur in any dental setting. It is essential for every dentist to be fully trained to identify, manage this particular situation. This course will focus on such common situations. Every clinician should have a periodic training of this particular aspect, and this is also which is recommended by the Dental Council, that every year that the clinician should undergo infection control and also medical emergencies certification. With a substantial increase in the chronic disease burden in the population, this also brings about a unique situation where we are seeing more patients with multiple conditions and are on different drug regimens, which will warrant the change of the dental procedure itself or to add or delete certain drugs that we are giving. It can also create a potential emergency situation in the dental setting. This program will try to summate all the relevant conditions in the dental office and to prepare the clinician to face such situations. So that's about dental emergencies and management of medically compromised patients. The next course would be on digital dentistry. This is a program which has become very important with the latest modalities in dentistry, which are encompassing a lot of software technology, a lot of hardware technology is coming in. This will encircle oral radiology, restorative dentistry, prosthodontics, and orthodontics. There is very little training in this subject as of now, but going forward, this will be one of the mainstays of the practice of dentistry itself, which we want to introduce. Next course is Smile Designing and Ceramic Veneers. This program will include smile analysis, software-based simulation, both two-dimensional and three-dimensional smile correction, step-by-step prep to finish ceramic veneers, including the materials and techniques to make smile correction very predictable. Next few courses would be on full mouth rehabilitation and treatment of wound dentition, orofacial pain and dental sleep medicine, which is again becoming very rampant in the population, single visit endodontics, predictable fixed prosthodontics, and lasers in dentistry. These are the programs that we have homed on. To execute the above programs, we have identified and handpicked the best clinicians from all around the world who will bring in their expertise and skills to impart to the participants. The whole team is geared up and excited to kickstart these programs. It has been a wonderful galaxy of illuminaries who are present at the start of this venture, who have inspired us always and have always given us a clear direction for us to follow and the goals for us to achieve. Thank you for this opportunity. Jai Hind.
Thank you, Doctor. Thank you so much. Thank you, Doctor. Thank you so much. So this is the beginning. So I'm sure Dr. Anand Krishna and Dr. Girish Rao have ensured that the programs are much needed. And I'm sure all of you who are participating here will take advantage from all these courses that are being launched. Moving forward, I would like to invite Dr. Jaikar Shetty, our guest of honor, to give the talk. He's currently the Honorable Vice Chancellor of RGUHS. He graduated from the Government Dental College, Bengaluru, and then specialized to become a very popular and respected professor of prosthodontics. He rose professionally as teacher to become the principal of AECS Maruti Dental College, Bengaluru. He has donned the role of a member of Board of Studies, then Chairman BOS, Dean of Faculty of Dentistry, Senate and Syndicate member RGUHS, and also the Vice President of the Dental Council. He assumed the post of Honorable Vice Chancellor about a fortnight ago, and today's program is the brainchild of his ideas. Dr. Jaikar Shetty, over to you.
It gives me immense pleasure to be here today for the launch of the Global Dental Academy. Hearty congratulations to Dr. Ajay Kumar and Dr. Girish and Dr. Anand Krishna. I'm sure this will be a significant step to progress in education. In this digital era of information overload from various verified and non-verified sources, it is important to have a curated focus programs by a renowned expert in that field. While we all understand that there is a huge need for knowledge share and upskill amongst dentists, such an initiative will optimize time and technology to its optimum. I personally believe better communication is the basis of improving the quality and availability of clinical information to doctors. And this is what GHA has been doing for the past years. Every such initiative is a milestone, providing that its people are repository of knowledge. Dentistry is a global profession practiced across the world, but the scenario of dentistry in India is very different from other developed countries. There is a need for knowledge leveling, and particularly in Indian context. By making required changes in the learning and teaching methodology, I am sure this will bring a substantial change. COVID-19 has had a devastating impact on the dental industry. With the ongoing pandemic, it is difficult to ascertain the extent and severity of its long-term impact at this point of time. The dental fraternity need to be very careful when it comes to practicing dentistry in this environment, as even a small slip in following protocols and taking precautions could cost a life. RGHS is one of the top universities offering the best medical and dental education in India, with initiatives to make its syllabi for different courses of the world-class quality. We look forward for such collaboration so that the quality healthcare reaches to the nooks and corners of the country, thereby contributing in making India a better nation. With such an impressive profiles of international faculty, advisors, academic council members, and brilliant minds coming together, we will bring a revolution in the existing pattern, thereby assisting dental clinicians deliver the best possible outcomes for our patients. Good luck to all of you. Thank you.
Thank you so much, Doctor. We look forward for RGHS achieving more heights under your guidance and under your leadership. We look forward to interact with you as and when we move forward. Moving ahead, our next guest of honor, Dr. Mahesh Verma, who is the Vice Chancellor of the Guru Gobind Singh Indraprastha University. Dr. Mahesh Verma is the Vice Chancellor of the Guru Gobind Indraprastha University. The government of India awarded him in 2014 with the Padma Shri, the fourth highest civilian award for his contributions to the field of medicine. He graduated with a degree in dentistry from the Government Medical College, Thiruvananthapuram, and secured his master's degree from the same institution, specializing in prosthodontics. He joined the Institute of Dental Sciences of Maulana Azad Medical College and became the head of the institute in 1995. He also did advanced training in prosthodontics at the State University of New York, Buffalo, and earned an MBA from the Faculty of Management Studies in the University of Delhi. He served as the Director Principal of Maulana Azad Institute of Dental Sciences, the dental wing of Maulana Azad Medical College, New Delhi. Dr. Mahesh Verma, over to you.
Thank you, Anita. Honorable Chief Guest, Dr. Ashwat Narayan in absentia, my dear colleague and friend, Professor Jakar Shetty, guest of honor, Mr. Austen Smith, President of British Association of Oral and Maxillofacial Surgeons, Dr. K.S. Nagesh, keynote speaker as well as former Dean and Director of Government of Karnataka, Dr. Vishal Rao, Dr. Ajay Kumar, Dr. Anand Krishna, Founding Director of GDA, Madam Anita Niranjan, MD, Global Health Academy, all the lovely colleagues, invited guests, ladies and gentlemen. It's a sheer delight for me to be present here amongst you at the occasion of a launch of Global Dental Academy, another arm of Global Health Academy. Dr. Rao, who's been a close friend, he's given me just 2 minutes. And also he ensured that I'm put in as a tail ender, like the last batsman. But well, it's such a pleasure. Sometimes everybody is waiting for the tail ender to fall so that everything can be wound up quickly. I'm very happy that, this is a global, they've used the word global. And from ancient times for us, the entire world has been one family. Austen is the only one here who wouldn't understand Hindi or Sanskrit. Vasudhaiva Kutumbakam, the Indian philosophy has been that the entire world is one family. And rightly so, that GHA or GDA or some of their arms, they have included this perspective. So they use the word global, ensuring that it is in tandem with our, what our thought, our philosophy. Everybody talked about challenges in healthcare, and we know that There are a lot of challenges, not only in dental education, healthcare delivery, and I was very happy to hear the comments made by Dr. Austen Smith, and he said, see, we still have teachers who would show a slide 30, 40 years old, but today we are looking for evidence-based, peer-reviewed, clinical evidence information, which is contemporary, and which is not something which is which has not been tested. So, and also Nagesh, he told us that how we evolved over the years and how we have today. In fact, I always say in my speeches that the entire world is looking at India. What next? And it's a great opportunity for us to leap forward. Also, I think everybody has mentioned about COVID pandemic, and I think pandemic has been a great learning for us, because it has not only told us, shown us, or demonstrated a lot of gaps which we have in our system, but it has also brought a lot of other things to the fore or to the surface, with issues which we face in a healthcare delivery day to day, especially for dental. We are talking, because today's launch is focused on dental, and I always say, it reminds me of a saying that water everywhere, not a drop to drink. Because we have a large population today, even today, in spite of so many dental colleges and such a huge workforce, who still have struggling, to have access, equity, affordability of the dental health care, and especially dental. So, we do have abundance of human resource, doctors, and on the other hand, services are not available or accessible. So, it cannot be left to government alone. Many of us who work in a government establishment, I don't think this entire role can be filled in by the government. I think all sectors have to come together to expand the services, to overcome the challenges, whether it is private or it is NGOs, or these are communities, professions. And I think, can I say that GHA and GDA can also, in their own way, can also contribute to face these challenges. Everybody talked about raising the bar of the profession. I think that's also very important. Raising the bar of the profession in terms of quality, robustness, sustainability. That's another challenge. And I liked Dr. Austen Smith linking it with some of the challenges, in education in UK. And so it's not just in India. I think this phenomenon is all over. So even if we get to even if we get to balancing the demand and supply, even then, our care has to be accredited. It has to be acceptable with the global standards. So there is a tremendous scope which is there to promote required skills, competencies, embedding technologies like artificial intelligence, Internet of Things, and value addition to nurture the profession. So there's so much of a scope, and I am sure that the World Health is, another thing I want to share with you, that this year has been a very very significant year for us. When the World Health Assembly recently, they had an oral health agenda which was adopted, and so we have a target. So in the next 10 years or so, we're going to integrate oral health into the general health. And Girish Rao is already integrating GDA into GHA. So I think it's a great thought also, and very timely. So we got to really do our act together to ensure that oral health is not separated from the general health, and that's not the way to go forward. So let me take this opportunity to congratulate the Global Dental Academy and its entire leadership, for their thought on this area. And I feel there is a tremendous scope which can be taken up by global Health and Dental Academy, through their multiple endeavors, which will surely pave way for skill enhancement, transformational and value-based care, sport, innovation, through their various verticals. They have, I think, 5 or 6 verticals already. I'm sure in times to come, they will expand it further. And this will surely benefit the professional communities at large and the humanity, following global standard. The word is global. So as Anand Krishna also said that, there's nothing which is in isolation, in silos today. What is being done in the rest of the world is, it can be easily copied and it can be easily practiced somewhere else. So I thank Girish, Anand Krishna for providing me this opportunity to be amongst you this evening. And I must say that I really enjoyed the thought process, the speech given by Dr. Austen Smith. What are they facing in UK, especially in smaller towns, in middle-level hospitals? What are the challenges they have? So we think that everything else, everywhere else other than India, things are fine, but every country has its own challenges and own situations. So and also Dr. Nagesh for refreshing us, telling us again where are we and where are we intended to go from here. So thank you so much. What we say in Karnataka, namaskara. Thank you and dhanyavad.
Namaskara, Doctor. Thank you so very much. So you are enticing us to have you in Bengaluru as soon as possible. Thank you for your lovely suggestions. I am sure Dr. Girish Rao and Dr. Anand Krishna had some internal agenda to have you here last speak with us. So all our participants stay with us till the end. It was a lovely talk.
And Girish, I would love to be part of your endeavor.
Oh.
Whenever you feel appropriate. I mean, I got so excited. I would love to be part of your endeavor.
Dr. Mahesh Verma, we actually postponed the inauguration just for your sake. Know how valuable you are, and we really, really appreciate your presence here today and your valuable support. And I'm sure we'll work it together so that our profession can actually get the benefits of all your vast experience. Thank you so much for addressing, and thank you so much, Austen and Dr. Nagesh, and all my gurus over there who have really spent time today. Thank you so much for being there with us today. Thank you.
Yes, Doctor. So we will continue to look up to you, Doctor, for more suggestions and innovative ideas to drive us in both the academy as we are indulging with technology as much as possible for new age teaching. So thank you so much, and it was lovely having you over. And at the end of the program, I take complete, this thing in thanking each one of you who made this program so very special. We have about 300 people who logged in throughout our program on our platform, and even now there are about more than 150 people still logged in our program. So thank you so much, each one of you. To begin with, I would like to thank Dr. Ajay Kumar, our chairman. I would like to thank our Honorable Minister, Dr. Ashwat Narayan, for sending us the message, and we look forward to have his support as we progress. Dr. Vishal Rao being with us and sharing a few light moments with us. Dr. Austen Smith, thank you so much. And it was, we came to know that even when we were coordinating, you were not feeling very well, but you really took interest and you participated in this program. Dr. K.S. Nagesh, so your talk, I think we all look up to you and for your guidance and the experience that you hold on your shoulder, so that we keep getting your blessings and guidance as we progress. And thank you so much, and continue to stay with us for this. Again, I'd like to thank our Honorable Vice Chancellor, Dr. Jaikar Shetty of RGUHS. Sir, thank you so much, and we look forward for interacting with you, collaborating with you as and how we progress. I would like to also thank Dr. Mahesh Verma. Really, it was a very nice talk, Doctor. We will continue to reach out to you more and more for your suggestions, and we look forward to interacting with you and have you over in Bengaluru soon. Thank you so much, each one of you. Dr. Girish Rao, Dr. Anand Krishna, look forward for a continued engagement. And thank you so much for being with us. Dear participants, thank you for the, spending your Sunday evening with us and, being with us today. We thank each one of you for being with us, and we look forward to get your suggestions, get your thoughts, so that we can inculcate it in our programs, so that it will be as lively as possible for all of you. Thank you, and have a good evening and have a very good Sunday. Thank you so much.
Thank you, Anita, for this wonderful program. Thank you.
Thank you.
Thank you, Dr. Girish and everybody. It was wonderful. Thank you.
Dr. Prasad, thank you.